If we can confirm that we're live, but it says that we are. There we
Yay!
are. All right.
Okay.
Yay. Okay. So here behind the scenes, because Anne thought she could do the technical side, we're a little late, but we are thrilled to be chatting with Dr. Jessica Myszak today. And she's going to share a little bit about her practice and how she does evaluations with our kiddos that are suspected of PDA. So, Jessica, can you just start out by sharing a little bit, give us a little background and kind of talk to us about what you do?
Sure. So, yeah, I'm a psychologist in private practice. My practice is the Help and Healing Center, and I am in Glenview, Illinois. It's a suburb of Chicago. So I work with people sort of in the Chicago area and beyond. I have ability to do telehealth. SciPact is kind of a cool thing that's come out in the last year or two, where participating states, if you are in one of the states that are included, then you could use telehealth with someone else that is sort of in that program. So Illinois is in that program, which is great. So I'm able to do telehealth with clients in a number of states too, and licensed in Wisconsin and telehealth in Florida too. So have sort of a broad reach to be able to work with different people, which is great. But the majority of my company right now is doing evaluations. So I do evaluations for autism, both for children and adults, and more specifically with PDA. And then I do some PCIT therapy too. It's parent-child interaction therapy, and it's a sort of a parent coaching model for young children that have behavior problems.
Very good. Well, we are thrilled to have discovered you, as we like to say, because our psychologists that recognize PDA seems to be few and far between. So we're thrilled to be chatting with you today. I was talking to you before we went live in that we had a really traumatic experience during our evaluation process for my son. And so I've been really passionate about trying to find professionals that do evaluations and think outside the box and are willing to be more flexible. So can you maybe just start by talking about what the evaluation process for, like, say I called you and say I kind of am suspecting PDA. I've done a little research, but I'm not sure. So I've given you the heads up that I think this might be what's happening. Or I guess the other thing is, do you have kiddos that come in that the parent has no idea about PDA, but you just meet the kiddo and you know that right off the bat you're probably going to have to do things a little more, like I said, maybe more choice, more flexibility, that sort of thing.
Yeah, absolutely. And I think, that has been going on before I even knew that PDA was a thing. So I think, part of that is sort of the benefit of experience. I've been in the field for 10 years and worked with lots and lots of different kinds of clients. And, some things that work with some clients just don't work with others. And that's okay. Um, so I'd say with families where PDA is sort of a question that they're coming in with, we always start with a parent interview, and I plan for at least 2 hours and sometimes more. But the family's usually had a pretty long road before they get to me. And so, I want them to have a chance to tell me everything and to, start from the beginning and what are the main concerns and what are they seeing, and then really getting back to the basics, when did they first start having problems and what were some of the earliest signs? So I can get a really, really clear picture on sort of what's important to them and what are they seeing and what have they tried and, what is working. So, from there, then we sort of make a plan. And, I tell every family that my goal is to be able to get a very clear picture on, how the child is functioning on, every different area. And sometimes we can do that and sometimes we can't. And that's okay. I think sometimes I'll have families that worry that, well, what if we can't get through this? What if my child just won't do it? And, what I tell them is, you know, if we can't get through something, I'm still seeing what's happening. I'm seeing the problems that you're describing, and that's giving me information. So it's different information, and we might have to be, like a detective trying to figure out, okay, how else can we get some of this information? But I'm not going to say, nope, just yep, can't get through this one thing. So I'm sorry, this isn't it. And actually, I'm working with a case like that right now, where the child is having a very hard time interacting with me, and that's okay. And so there'll be more time talking to some of her teachers, and mom's going to be getting some videos, and just sort of supplementing with whatever we can do, so I can really get a clear picture of what's going on, because she is really, really struggling.
I love to hear that that you really are finding different ways to get the information that you need, as opposed to, again, I would say in our situation, when Drew chose not to cooperate, and it was like, okay, we're done with that and move on to the next thing. Or to also make, at that time, I would say, assumptions about what that meant, versus digging deeper and doing the more detective work of, but yeah, it's interesting that you say that, because if you can't get through it, the fact that they can't get through it is giving you information as well.
Yeah, well, and I think the testing process is hard for kids with PDA, because, so many of the tests that we use, you're trying to get sort of a ceiling. And so you keep going until it's so hard that they can't go any further. And that's really stressful. Kids know that they're getting the answers wrong. And so it's like you're hammering into this, and it's very uncomfortable.
And especially our kiddos that, a lot of them tend to be perfectionists, and if they can't do it perfectly, then they just don't want to do it. So that, I'm sure, exacerbates that.
Right, right. And I think that's part of the experience piece too, is, when we're trained to do these assessments, you were trained to do them exactly by the book, and to follow, this standardized, verbiage that you are going through. And, that ideally, yes, that works great, but there are kids that does not work well for. And I think you can still get a whole lot of information, um, you know, keeping an eye on what they're able to do independently. And, even if you're offering a little bit of help, I think there's options there that you need to be aware of.
Sure. I also love that you spend so much time with parents at the front end, because, like you said, that a lot of parents have probably been through a lot before they get to you, and not knowing and understanding. I know Heather and I were both in that position of, we obviously knew there was something going on, but, even asking other professionals along the way, nobody could really put their finger exactly on it. A lot of our PDAers, they make eye contact and they're social, and so they can't be autistic.
Right.
um, what kinds of things would you suggest for parents that are listening today? What kind of information would be beneficial for them to share with you, as far as, like, what's going on with their kiddo? Is there anything that they should be keeping in mind to be sure? Well, and when I say you, it might be you, it might be obviously, another psychologist that they're working with. But what kind of information should they kind of be thinking to be ready to share that would be helpful to you?
Yeah. Well, so, it sort of depends on the kid, but I think, definitely keeping track of, when the problems are happening, what are the biggest problems, and when are they happening? And is there something, can they anticipate these problems happening? Is there anything, happening afterwards? So kind of, yeah, sort of the antecedents and the consequences of different types of things, I think, are super important. Um, and then also, if they have opportunities to see that child around other kids, what does that look like? Because I think that's sometimes the piece that is a little bit harder to get in an evaluation. And so, do they? Yeah, I mean, so kids are playing together, but what does that look like? Is one child sort of directing all of the play, and sort of making the rules, and enforcing them in a way that everybody else, has this very, thin lane that they need to stay in. Um, and then also, if they have, sometimes documentation from other places, if they have notes from school, if they have, report cards that have discussed, things going on, I think sometimes it's helpful to have some of that documentation in place too. And then anytime we're looking at autism, we're going back to some of those early signs. So, maybe getting out the baby book, or, really thinking back to, when did we really first start wondering if there might be something going on, and trying to articulate some of those earliest things that they might have wondered about, because I always ask about those.
So when you're looking at an autism assessment, but who you're seeing in front of you doesn't, they don't have the classic autism characteristics, and we might be looking at, or you might be looking at an atypical presentation.
Mhm.
What instruments, what evaluation instruments do you use when, you're not seeing the classic autism, but you suspect that there might be, an atypical presentation there?
Yeah, there are a couple of good instruments. One is it's the SLDT, and um, it has different sorts of pictures and things, and so it's pictures of children and adolescents and adults in different scenarios with little thought bubbles over their head, and so it's encouraging the child to think about what is this person thinking, and how do you know that. And it has some other components too, in terms of, yeah, how do you sort of problem solve this situation? So it's looking at some of these sort of social aspects that might be harder to kind of get at. There's another one called the CAPS that is similar, but it has little video scenarios. So the child watches the video and then either says, was something wrong in this situation? How do you know if something was wrong? Or how would you react? And so with that example, they have to sort of look at some of the body language that the different characters are using, and sort of read that scenario right in the moment to be able to react. And so it gives us some information in terms of some of the social and communication skills that might be a little bit harder to pick up on.
And oh, no, go ahead, Anne.
No, I just said interesting. That's all I
Yeah.
said. Go ahead.
We as Anne said before, we get a lot of parents that contact us, or even come into our chats and our coffees that we have, that they are their child may have already had an autism assessment done, and the assessor didn't look at past the typical ADOS, that kind of thing. So it's what would you say to this parent who keeps hitting the roadblocks? How would you, I'm getting tongue tied here. How would you tell the parent to go find another assessor? Did that make sense? Like,
Yeah, no, absolutely.
Give them so that they were confident enough to go to another practitioner and say, there's still something going on.
Yeah. Well, I mean, so the ADOS is sort of notorious for not catching, the atypical presentations of autism. And it's sort of a performance measure. So if a child can mask and perform for 45 minutes, you're, very likely not going to receive a score that's indicative of autism on that measure. And the ADOS has its uses, but I too often see that being used as, the gold standard measure, and if they don't meet it, then nope, can't be autism. And I think that's a big problem. So yeah, I mean, I certainly encourage families to reach out to somebody who, not saying don't use the ADOS, but somebody who looks at other measures too, and sort of sees the ADOS as one measure and not necessarily the only answer. I frequently see, yeah, both children and adults who have sort of not met a certain score on the ADOS, and we'll do second opinions on those because it happens a lot.
Right. And we see that a lot when parents are trying to get an evaluation done for school, like to go maybe on an IEP because their children need more, supports and services. And the schools they bring out the tried and true, and they don't see autism as for an educational component there.
Right.
So another big kind of issue that we see is that because pathological demand avoidance is not mentioned in the DSM-5, then it can't be diagnosed. So, could you take us on, kind of the journey for you, and how you were able to identify PDA as a profile of autism?
Yeah. So yes, when I diagnose a child with PDA, the official diagnosis reads as autism spectrum disorder with a PDA profile. And so the autism is there. Um, and that's the ICD code, that's the DSM-5 code, that people need for insurance and need for, for whatever reason. But I do think that having the PDA profile on there is really, really important for anybody that works with a child. Um, I think just putting autism, many of these children are going to go back to their schools and people are going to be like, this child doesn't have autism. What are you talking about? This doesn't make any sense. This doesn't look like what we know autism looks like. And so I think having that PDA piece on there is important, one, to help everybody else know, what that means and how, what sorts of strategies and things are going to be most helpful for the child. And I also think, I think information about pathological demand avoidance is going to come from, you guys here, getting information out and promoting this, but also it's going to come from families who are coming back to their school systems and coming back to their doctors who didn't know about it and can learn about it. And, chances are they are not going to be the only student that's going to be dealing with that in that school. So I think it's really helpful for them to come back and sort of educate. It's hard. It shouldn't be the responsibility of parents to go and educate everybody working with their child, but I think it is important.
Right. Ann and I are both former teachers, and we've had this, Ann and I've had this discussion before. We can sit back and go, oh, I remember this and it makes perfect sense now, and had we, hindsight's always 2020, but had we had the information then that we have now, it would have, we would have been able to provide a better environment, better supports, for that particular student or students.
Absolutely.
Yeah. I've got a couple kind of off. I was just writing some questions down as you were speaking and when you were introducing yourself. When you said that you're licensed in different states because of the pack that they have, are you able to assess virtually for the entire assessment, or do you have to have face-to-face?
Yeah, I do some evaluations completely over telehealth.
Okay.
So, and again, it looks totally different for different kids. And it's always interesting because I think sometimes families worry that, either one, there's sort of a, novelty effect and the child is doing really, really well with me over telehealth. And, they're like, oh no, she's not seeing the problems. She's not, and, it's okay. I don't have to see the tantrums. I don't have to see the meltdowns. So, that's all right. Or, sometimes it's really hard and the child does not want to do that. So yeah, I mean, I think the benefit of telehealth is that it's really easy to sort of space things out in a way that is a lot harder if you're actually going somewhere for an evaluation.
Right.
And one of the cases I'm working on right now, we're trying for an hour here, trying for an hour here, trying for so we can space it out and things, we're going to take a couple days off and that's okay. I think that's a lot easier to do, especially if a family's not having to travel for an evaluation.
Right. Right.
That's what I wanted to ask about is, I mentioned to you that one of the moms in our morning coffee group yesterday mentioned that, she had seen you. She said it was okay that I mentioned that. So I have permission. And like I told you, she was just singing your praises in that how wonderful you were with her daughter and how flexible you were and how you provided choice. Can you talk to us a little bit about that as far as, again, like our situation was they sent us the schedule, here's the dates, here's the times that you need to be here. And basically if we wouldn't agree to what they had on there, then, just get back in line kind of thing. And some of them were for the least amount of time was like 2 hours and the most was like 3 hours. And,
Mhm.
I remember seeing that thinking there is no way that my son's going to do something for people he's never met before for 3 hours, 2 hours even, but much less
Right.
3. So can you talk to us a little bit about some of the things you do to provide that flexibility? And so, if it's a kiddo that is having a tough time, maybe cooperating or doing what you're asking them to do, what are some things that you do to provide that flexibility?
Yeah. So, even from starting from that parent interview, I try to ask the parent if there are any specific triggers that I should be aware of, or, if there's any specific interests that the child has that I can, kind of incorporate and bring up. And I think that that's good to kind of have. And then the very first meeting I have with the child, I try to learn more about them in a really sort of unthreatening way and ask them about their interests. And, especially if they're at home and I'm seeing them over telehealth to, show me your room. What does your room look like? I'd love to see, the things that you like doing. And so most kids like that. They like kind of showing stuff off and showing their pets. And so, just kind of starting from there. And then, there's always things to do. So just being able to offer, different choices. Would you rather do this or would you rather do this? Um, do you need a break? And then, you know, if we're meeting over telehealth and, as the session is going on, do you want to try to do something else or do you think that we've done enough for today? And I try to let the child have an equal say in that. And, I want them to be able to do the best they can. So I don't want to push them. And again, my goal is always for them to come back and see me again. So, I try to get the most important stuff done on the front end because I think there is sort of a novelty thing at the beginning where I can sometimes get some stuff done earlier that might be harder later. Um, but also, I don't want to push them to the point that they are done and don't want to come back. And so trying to kind of leave it open like that.
And, as you were talking, it was making me think about how we talk about all the time that with our kiddos, um, building a relationship is key. Without a relationship, they're pretty much not going to do anything for anyone.
Mhm.
And so I love how you said that you really spend that time getting to know them on the front end. So that obviously sets you up and them up for more success. Um, and then also, it made me think of how our kiddos have a hard time seeing hierarchy to where, like you're the psychologist, you're the doctor, and they're the patient.
Mhm.
And just like when you said, do you think we should do a little bit more? Do you think, we've done enough for today? Like giving them, the voice to say, yeah, I like if they're really enjoying it, which the way that you present it, I can see how that could go that direction.
Mhm.
Or, really if they've done enough that they have the choice to say, yeah, I'm done for today. And that making them want to come back again,
Mhm.
because they know that you will give them the out to say, no, I'm done. So I just love how it just goes along with, I mean, obviously, that, but, I love to hear when professionals, obviously, you really get our PDAers and you get there all these little nuances. We always talk about our kids that they're so nuanced. They're, um, and it takes a while to understand all of that, even as their parent. So I just love how you fit all of that in. And like the mom that we talked about, um, said that you had mentioned like you could even meet them at a park if that was a more comfortable, like less, I don't know, she didn't use the word threatening, but like instead of an office type
Mhm.
environment, it was a little more.
Yeah, no, because I can't practice in every state. So I do have families that will travel to see me here. And yeah, I mean, one of the questions I get is, what if we get up and they won't come? So like, I will come to you. We will make it work. So yeah, I mean, I try to make it go well. I'm not going to tell you that it always goes 100% smoothly because it does not. Um, but try to be flexible and I think usually it does go well. Um, and just sort of yeah, do what we need to do.
Yeah, and I don't think there's any PDA parent that has the expectation 100% that it's going to go well.
Right.
We laugh about that too, like, wow, even if it goes, like halfway well, like that's a huge win.
A win. Putting that one in the win column.
Yes.
Yes.
Heather, do you have other?
I have I do have one question that I wrote down. Going back to when you were introducing yourself and you were explaining the services that you provide, you had mentioned that you do the PCIT therapy.
Mm-hmm.
Is it, am I saying it right? Picked or?
It's just PCIT. Yeah.
Okay. How, how well does that work? Like, do you have PDA patients that you actually do this therapy with? And if you do, how does it work with them?
So So the full PCIT protocol, I would say, probably is not the best thing for PDA families. Um, it's divided into two parts, and I think the first part could be really, really helpful with PDA families. It's designed for children who are young, so kids 2 to 7. Um, so I like to advise, families, I think, especially if they think they might be sort of at risk for PDA and have really little kids, I think it could be a really, really good fit. It is a behavioral therapy. So, either it's going to work really well, and it often does, or it may not. And I think that gives you information in terms of, if PDA makes sense as a diagnosis too. I have consulted with families before who have really young kids, and my suggestion is try PCIT and see if it works. And I think if it works really well, that's sort of evidence that it may not be PDA. But it's research based. It's effective with almost all kids. If it doesn't work, that's
Mhm.
that gives you information. But yeah, it's a parent coaching model. So I'm doing that over telehealth too. So even in person, the psychologist is in a separate room, sort of behind a one-way mirror, just monitoring and coaching a parent over earbuds. So it lends itself very well to telehealth. But the first phase is just sort of strengthening the relationship and using some play therapy type skills and things just to really sort of build up the child and let the child take the lead, which is very similar to a lot of PDA strategies.
Mhm.
Um, so I think that component is really, really good. And it sort of lets me sort of guide and coach. And the second phase then moves into sort of discipline and consequences and effective commands and things like that. So, with many kids that works really well. But yeah, I think that's probably
Not the,
not the best strategy for PDA.
but I do like that it can help you kind of weed out rather quickly in that age group right there,
Mm-hmm.
and whether or not, are you also able to, I'm sorry, this just popped in my head. Are you able to like determine if it's oppositional defiance disorder versus PDA within that 2 to 7 age group?
That's a good question. So I think PDA is hard. It's hard to diagnose in really little kids just because, so
Mhm.
much of early development, can look like PDA and, you know, 2 and 3, I mean, we're expecting kids to be sort of asserting their demands and, sort of learning how the world works around them. And so, I think as they get a little bit older, um, yeah, I mean, there's some fine differences there. Yeah. So, I mean, that's kind of a hard question to
No,
answer, but
that's
yeah.
understandable. We just, again, we can almost tell a new parent who comes into our group what they're going to say. It's like these parents have such a common thread that
Mhm.
their kiddos have been, they're diagnosed with ODD or conduct disorder or, some kind of reactive attachment disorder. So it's like, it's just like, it's one of those things where how do we see the PDA and how do we diagnose it? And how do we, what the nuances of that, and having practitioners that understand PDA so that they're not getting that over, that ODD. Oh, they're not doing what you wanted to ODD, so,
Right.
that was just kind of the reasoning for my question there.
Yeah. No, and I hate the ODD diagnosis. I think you know, there's a
Oh,
problem and we don't know why, and we're not going to really look into,
right.
why this is happening. There's always some reason.
Yeah, we that was our first diagnosis as well. But that was just from a pediatrician in an office without really, well, just observation from how horrible the visit was going.
Oh.
Um, I I had thought of something else is, um, so because we feel like there are very few of you that, because PDA is not in the DSM-5, what is it what was your aha moment, or what was it that convinced you that PDA is a legitimate diagnosis, even though that it's not in the DSM-5? And piggybacking on that is, what would you suggest that, let's say that I was going to have my child, an evaluation done here, and I'm searching for a psychologist. What Either what kind of questions could I ask, or what information could I provide to them to say, this is what I'm thinking. Is this something that you've heard of, or whatever? But kind of, where did you discover PDA, and how were you convinced that it's not just,
Yeah, yeah. Well,
Mhm.
so I met Diane Gould, who runs the PDA North America
Mhm.
site, and so she kind of introduced the idea to me. I wasn't familiar before that, and then started, we're in the same kind of geographic region, so she started saying, "Hey, there's this training, there's this training." And so I thought, okay, yeah, sure, I'll do this training. And um, it was an interesting training because it was parents and professionals kind of all together. And so um, I thought it was informative and really helpful and interesting. But it really struck me just how, some of the parents that were in the training, it just like, wow, this is a lifeline for us, and seeing, how much of a difference it made for them. And that really spoke to me, and I've been doing evaluations for a long time, and already sort of tailoring them to sort of whatever I needed. And so, I was like, I could do this. I like the challenge. I like working with different kind of people. And so yeah, started looking more and trying to find every book I can read about it and just get more into it. Um, and for your second question, kind of looking at, yeah, I mean, so what should families be asking for if they are looking for someone to evaluate? So I think number one, asking if they know what PDA is, because if they're not familiar with it, there's no way they're going to diagnose it. And, I think psychologists are talking about it a little bit more. I'm on some big sort of psychologist groups on Facebook and things, and people are talking about it. So I think the word is getting out there, but I think there's still lots of people that just don't know much about it. Um, Two, I think you need someone that has the experience, that understands that there are times where you don't have to do everything exactly by the book, and it's not going to work if you do that. I think some clinics use students, and this is not a situation where you want to be using a student who is learning how to give a test, because they are not going to have sort of that experience and the ability to sort of shift gears as they need to. Um, and then let me think. I think also just, yeah, I mean, someone who's going to take the time and listen, because it's not going to be, okay, we're going to fit all this into 30 minutes and then we're going to work with the child for 2 hours and that's it. We're going to get everything we need, because these are more complicated cases and we need to sort of look at other information. And, so it's just somebody that is willing to sort of take on that challenge and have the time to do it.
and for me, I think I didn't I should have known. I mean, Heather said, I'm a former educator myself, and I've been through the educational side of evaluations with students and things, but I had not been to the medical side of things. And to be honest, I kind of felt intimidated, like, well, this is, and we live in a more rural area, so it's not like I have tons of choices of
Right.
uh or I guess I should have, at this point should have looked further, but locally there aren't a lot of choices. And so I think I felt intimidated that, like, I didn't want to ask or assume that, like, or even me getting to the person I needed to talk to. I did try to advocate ahead of time. And like you said, I wanted to share some triggers and some interests, like he really likes trains and he likes this. And so that would be a way to build. So I just appreciate what you shared, because also, my message to parents is always, you have to advocate for your kiddo, because if you don't, you know, if it is somebody that's not as flexible or doesn't know, it's just probably not going to go so well.
Right, right. Well, and it's hard because I think there are a lot of clinics and things where they have their way of doing things. And, you know, unfortunately, I think that, there's wait lists and, there's a lot of red tape that goes along with a lot of these things. And so, there's not a lot of extra time that, you know,
Sure.
it's a
And
problem.
just,
Yeah.
I think encouraging parents to, I didn't ask enough questions, I guess is what my message would be. And, know what you're walking into a little bit more than I did. Even though I tried to advocate, it was kind of like, then once we got in there, it's like, oh, okay, I think they didn't get my message or whatever, but it's so refreshing. And I love talking to you. And we've talked to a couple other people that it's just so encouraging for Heather and I, who already have our sons, with their diagnosis, and we're living a PDA friendly lifestyle, and our boys are being very successful. But it's really encouraging to hear from you, because I can just imagine, like, I think, oh my goodness, if we would have, known you or someone like you, what a different experience it would have been. So how we'll post it as well. But if people are in your area or they want to check out the telehealth, how do they get a hold of you?
Yeah, so I have a website. It is helpandhealingcenter.com. My email is on there, or you can give me a call. The number is 847-558-7321. I also have a TikTok channel where I'm promoting some content about autism, sort of atypical autism. So it's autism in adults and PDA. So you can check me out on there. I'm Help and Healing Center on there too.
Yay, I'm excited to check out your TikTok. Send me
It
your
was exciting.
website then.
It was one of those things that there's, people are talking about autism on there. And so it seemed like an opportunity to, put some information out there, and it's been pretty well received.
Excellent.
Absolutely. That's exciting. Anything else? Anybody have anything before we wrap up?
Thank you so much for having me. This was awesome.
Yep.
Well, thank you.
Mhm. And thank you for your patience and
Not a problem.
difficulties straightened out.
Like I said, I'll stay in my lane from now on. Sorry you had to learn that along with me.
All right.
Thank you so much.
All right.
Thank you.
Thanks. Bye-bye.
Bye.